Hello, Dr. Marquette. My name is Skylar, and I'm a student pharmacist here at the clinic. I'm here to get back to you regarding Madeline Channel. Date of birth is 9/2/1999. I'm here to just get back to you regarding the patient as well as an article that I reviewed for her that looked at Tylenol use or acetaminophen use during pregnancy and its association with the increased risk of children's autism. And I was wondering if you just had the time to discuss. Great. Starting out with a little bit of the background of the patient. Patient is a 26-year-old pregnant female with a past medical history of frequent tension headaches and back pain attributed to a car accident about 2 years ago. She presents today in the clinic for her first prenatal visit at 7 weeks gestation, last menstrual period on 9/28/25. Currently, one of her main concerns during pregnancy is her Tylenol use. This is mainly just due to the mixed information that she's been hearing. She's heard that, acetaminophen can increase her risks of her baby's autism, or just increased risk of autism in general for her baby, as well as she's also heard from ACOG that it has no evidence of increasing risk in childhood autism. So she's just a little confused and needing some clarification. Social history, she denies smoking, but drinks about 2 to 3 times per week. Home meds, currently taking that Tylenol, 650 to 1,000 milligrams as needed. She used to take ibuprofen, but has not been taking it since she found out she was pregnant. And then currently she's on a prenatal vitamin and does not have any drug allergies. Moving on to the assessment, the patient has uncontrolled pain due to tension headaches and chronic back pain during her pregnancy. Just a small blip of the evaluation of this. Again, the patient 7 weeks pregnant with her last menstrual period on 9/28. She does drink about 2 to 3 drinks, which could increase the risk of problems with fetal development. And she obviously uses Tylenol. Moving on to the justification and the use and the journal itself, it was published from JAMA, and the title of it is Acetaminophen Use During Pregnancy and Children's Risk of Autism, ADHD, and Intellectual Disabilities. Inclusion criteria were singleton live-born children in Sweden with a linkable personal identifier from July 1st to 1995 to December 31st, 2019. So the patient, this is a very broad study that it looked at, so the patient could be included in the study. Exclusion were children, basically if they had any missing information about their mother, so if they didn't have any information about their mother's country, age, region of residence, household education, or income. So naturally, our patient will not be in that category. Primary outcome was the ICD code diagnosis of autism, ADHD, or intellectual disability. Currently, there were no secondary outcomes. However, they did look at a lot of other covariates in the study. Doses they used 3 different doses: low doses of less than 166 milligrams per day, medium dose 166 milligrams to 429 milligrams a day, and a high dose of greater than 430 milligrams per day. For the statistical analysis, the study looked at different models, and basically as the models increased or changed, it would also change the number of covariates. So model 1 would have the lowest amount of covariates, model 2 a little bit more, model 3 a little bit more, and then lastly, the sibling analysis had all covariates as well as basically a comparison of siblings to account for any unobserved genetic confounders. Results: the sibling control analysis did not find any correlation of acetaminophen use and increase in the primary outcome, so those being autism, ADHD, or intellectual disabilities. Patient currently meets those inclusion and exclusion criteria, so the study can be applied to the patient just based off the general large sample size, which included about 2 million people. Standard of care, current guidelines, including ACOG, recommend the use of Tylenol for headaches, fever, early signs of preeclampsia, as well as pain, as they state that conditions that they treat are more dangerous to the fetus than the medication itself. Other NSAIDs or the other analgesics like NSAIDs are not recommended due to those increased risks of fetal defects. Moving on to my recommendation, I suggest that we counsel the patient on emphasizing other treatment modalities such as physical therapy for her back pain, and then letting her know that it's okay to take Tylenol. Will recommend 500 milligrams, 2 tablets by mouth at the onset of acute headaches and chronic back pain for a max of about 4,000 milligrams per day. We're going to have her avoid taking NSAIDs and other over-the-counter analgesics like ibuprofen and naproxen due to those fetal effects. We're going to discontinue her alcohol use just due to those increased in fetal alcohol syndrome. And lastly, we'll continue that prenatal vitamin. For clinical monitoring, she'll obviously want to monitor for the back pain and headaches, and she'll also want to monitor the frequency of the headaches as well, because those should be treated properly if they continue and or worsen. Those pains should be journaled or logged using a pain score from 0 to 10, just so she can kind of keep track of if it's worsening or improving. Follow-up should be with an OBGYN in about 5 weeks at her 12-week appointment to reevaluate her pain management. In conclusion, I believe Madeline is safe to use Tylenol throughout her pregnancy, and there's no reason to believe that Tylenol will cause autism in her child. Any questions? Thank you.